More Idaho Matters now from the studios of Boise State Public Radio News. I'm Gemma Cadet. It was 6 years ago when Idaho voters approved Medicaid expansion, which opened up health insurance to many who couldn't afford it. Well, since then, advocates of expansion say the 100,000 or so people who are currently part of the program have benefited greatly from Medicaid. And the Idaho Department of Health and Welfare says Idaho hospitals have saved $42 million in charity care. Now, some Idaho lawmakers have tried to curb or overturn Medicaid expansion, and they've done this as recently as the 2024 legislative session. And supporters of the program have been lobbying diligently to keep going. The American Cancer Society Cancer Action Network and Idaho Voices for Children have created a new short film. It's called Idaho Supports Medicaid, in Our Words, where Idahoans tell their stories. And that film premieres tonight in Boise. So here today to give us a preview are Randy Johnson, the Idaho Government Relations Director for the American Cancer Society Cancer Action Network, and Ayla Birch with Idaho Supports Medicaid. I want to welcome both of you to the program.
Hi, thanks for having us.
So Randy, let me start the conversation with you. What have you been hearing from folks who were on the Medicaid expansion program?
What we've been hearing from folks is that this program works, especially knowing that it was passed by Idaho voters, and this is a popular program. And without coverage and access to care, many folks wouldn't have access to health care, especially for cancer screenings, for checkups, for preventative care. And so that's what we want to be able to talk about today is just this is a program that is working and is really benefiting Idahoans.
So, Randy, talk to us about what the American Cancer Society has said in regards to Medicaid expansion here in Idaho, because what it says is that Medicaid expansion has saved our state a significant amount of money, at least $78 million. Where are you getting that big of a number from?
That comes from many different aspects. It comes from if folks can get in and have preventative care and catch cancer early, especially before having to go to the emergency room where we know that increased costs will happen. That's one. We're looking at realized in the Department of Corrections, in behavioral health programs, in county indigent and catastrophic funds. And so it's really coming from when folks get care and they can get care early, it's not escalating those costs.
So, Ayla, tell us about your organization, Idaho Supports Medicaid.
Yeah, thanks, Gemma. So Idaho Supports Medicaid is a coalition that falls under Idaho Voices for Children. And what we are doing is we're just trying to protect Medicaid expansion. We heard from the ballot in 2018 that voters are in favor of having Medicaid expansion. And last summer, our organization did a new poll that actually showed that more people than at the 2018 ballot are in favor of Medicaid expansion. And so we're just trying to raise awareness and gather allies and supporters and people with lived experience to really just drive home the importance of this program and what it means to Idahoans.
Mm-hmm. So, Ayla, how does your organization work to keep Medicaid expansion continuing here in Idaho?
Yeah, so we do lots of grassroots organization and work with some lobbyists that we hire and contract with. We work with great organizations such as American Cancer Society Cancer Action Network to put together amazing events like tonight to just kind of educate the public, educate lawmakers about the importance of this program.
So, Ayla, tell us a little bit about the documentary. Who are some of the folks featured in the film?
Yeah, so the documentary is something I know that I'm very proud of, and I'm sure that Randy is too, but we highlight a physician in North Idaho who shares his experience as a physician, what Medicaid expansion has done for his patients. We have two individuals who share their story, one of which has had a couple of bouts of cancer and is now currently cancer-free, and he shares a little bit about how Medicaid expansion has helped save his life. And then we have another gentleman who shares his experience with Medicaid expansion after having been incarcerated for some drug crimes, and just how Medicaid expansion has really helped him be able to become a productive citizen in society and in Idaho. And he's now working part-time. He's going to school and doing really great things. We also have another person who shares their experience as like a care coordinator, where her whole job at the Shoshone-Bannock tribe is to make sure that her patients have access to care. And so she speaks to the importance of Medicaid expansion, especially in that Native American community.
And Ayla, I mean, we are a rural state. We have a lot of areas where, there isn't a doctor in town, right? You have to travel to go to the doctor. And I know the physician that's featured in the film in North Idaho, he talks about that, right? Like the difficulty of getting medical care in parts of rural Idaho.
Yeah, for sure. It is a big problem. And especially if you have something as serious as like a cancer diagnosis, you're not going to be able to get great cancer treatments in those rural areas. You're going to have to travel to a larger city to be able to access that care. I do know tonight in our panel, we are going to have a panelist who's a social worker who works with folks in the oncology department and get them set up. And she's going to speak a little bit to how important it is for the rural community for us to continue Medicaid expansion so that folks like that can have access to care, even if it's not in their hometown.
So I know, as you mentioned, there's at least one person in the film from Pocatello. He's a two-time survivor of prostate cancer. So Randy, how important is Medicaid expansion for folks who are diagnosed with cancer?
It's more than just people who are diagnosed. It's anybody who can be able to get all the services needed, right? I mean, there's screening. So if you can get screened early, you have a better diagnosis and a better chance. Once you have cancer, you have to hear those words, you have cancer. The American Cancer Society estimates about 11,120 people this year alone in Idaho will hear those words, you have cancer. And being able to navigate those words and your treatment and not have to worry about how you're going to get covered and what was going to be covered. Those are the type of things that are so important to folks who are just trying to do the right thing, trying to survive, and creating barriers to that that's what's important, is to eliminate barriers and make sure people can get the help that they need.
So Randy, talk a little bit more about that. I mean, you mentioned preventative care, early cancer diagnosis. We know that when people don't have insurance, one of the first things off the list is that it is that preventative care, right? Maybe a woman doesn't get a
Right.
mammogram, right? She doesn't go in for her, annual exam, and we know that these diagnoses are not fatal if you can get that early detection. So just talk a little bit more about how, Medicaid and preventative care kind of go hand in hand many times.
Well, absolutely. When you have access to covered and you have care and those screenings are going to be covered and your medication is going to be covered, it makes those decisions a lot easier to be able to go in and have that screening. But yeah, if folks are trying to figure out if they're going to put food on the table or worry about how they're going to pay for health care, a lot of times people are worried about the immediate problem, and these preventative services help drastically being able to improve quality of life and just extend that forward. In Idaho, about 43% of employers offer health insurance to their employees. And so where are the rest of those folks going, And so having Medicaid and Medicaid expansion as one of those areas for them to be able to make sure that they can get that care and they're not of just falling short and being able to access that care.
So Ayla, let's talk numbers, because you've looked at numbers when it comes to the popularity of Medicaid in Idaho. So how popular is it?
Yeah, so I am, with my role with Idaho Voices for Children, I'm more focused on the story collection aspect where I work with folks with lived experience. So in terms of
hmm
numbers, I don't have that data off the top of my head, but I just know that it is more important based on that poll that we did last summer. But I did kind of want to speak to a little bit about what Randy had just mentioned. Is I had just collected a story from a family a couple of weeks ago where their kids had qualified for Medicaid, but they did not. And then when Medicaid expansion was passed, all of a sudden, the mom and the dad were able to access medical care that they had been putting off for 6 years. And so for them, it was a life-changing thing for them to be able to access the meds that they need and be able to go see the dentist and go to the doctor for these routine screenings and whatnot. And she just said it was just such an important thing for them because in order for us to take care of our kids, we have to be able to have our parents be able to take care of themselves as well. And I think that Medicaid expansion just does that so beautifully, especially for that example and that family.
So before I let you
Gemma,
go,
if I may,
yeah, go ahead. Yep, absolutely.
I just wanted to say, and that's exactly why we're doing this work, is to humanize and being able to show folks that these are everyday Idahoans who are getting services through Medicaid and Medicaid expansion. And it is popular. You're asking about the polling numbers. There was a poll done this summer where, 75% of Idaho voters have a favorable view of Medicaid, and 60% are in support of Medicaid expansion, and this passed the ballot with 61%. So we've only seen an increase of support of Idahoans for these services, helping those who need it among us be able to get health care.
And very quickly, the film premieres tonight. There's also a panel after with a discussion. Ayla, is it open to the public? How do people figure this out?
Yeah, it is absolutely open to the public. As you said, it is tonight. It's at Treefort Music Hall, which is at 722 West Broad Street in downtown Boise. And the doors open at 5:30. The show begins at 6 o'clock. There will be the short film that highlights some of these stories that we've been talking about. And then after that, there will be a panel that has some experts in the Medicaid world in our state, and also that social worker that I'd mentioned. And they're just going to be able to discuss Medicaid in Idaho and kind of show the urgency of why we're still talking about this after it's already been passed. And just kind of, I'm hopeful that people will come and be so moved that they will take to heart the action steps that we're going to give folks and help have some new allies to help us when it comes to legislative session, to just share stories, testify, all the things that we need to be doing to make sure that we're keeping Medicaid expansion.
Thanks so much for listening to Idaho Matters. Boise State Public Radio and Idaho Matters are members of the NPR network. It's an independent coalition of public media podcasters. You can find more shows in the network wherever you get your podcasts. I'm Gemma Gaudette. We'll see you tomorrow.
No matter what happens in Washington, the NPR Politics Podcast is here for you. For the latest news, insights, and analysis from the election and beyond, listen to the NPR Politics Podcast.